From UNDP in Zimbabwe, I am Joyous Ferguson. Ahead of the Global Fund's 8th Replenishment Summit, this is our pulse check with resident representative Dr. Ayodele Odushola. Dr. Ayo, the governments of South Africa and the United Kingdom, together with the Global Fund to fight AIDS, tuberculosis, and malaria, have announced that the Global Fund's 8th Replenishment Summit will take place in Johannesburg this November on the margins of the G20 Leaders Summit. As co-hosts, South Africa and the United Kingdom are championing solidarity, sustainability, innovation, equity, and reform. These are principles at the heart of the Global Fund's partnership model. Ahead of the Replenishment Summit, Dr. Ayo, please share with us how UNDP in Zimbabwe, in support of the Government of Zimbabwe, champions or has championed these principles.
Thank you, Joyous. These 5 principles, solidarity, sustainability, innovation, equity, and reform, really captures what our work is all about. And by the way, I want you to know that Zimbabwe's grant is the largest within UNDP's overall Global Fund portfolio. And we are trying as much as possible to ensure the 5 principles are fully ingrained, not only in the formalization, but also the implementation of the grants. When we look at solidarity, it has been at the center of UNDP's partnership with Zimbabwe since 2009, when we stepped in as interim principal recipient of Global Fund grants. Over the years, we have managed more than 20 grants, worth close to 2.8 billion, making sure resources are translated into real services for the people who need them most. UNDP has been working with the government and people of Zimbabwe to ensure health services are delivered to the most vulnerable and marginalized communities. On sustainability, it's about building systems that last. UNDP may still be the interim principal recipient for HIV, but we have also supported the Ministry of Health and Child Care take full leadership of the TB and malaria grants. As fund administrator, we provide strong financial and procurement oversight, but the vision is always long-term sustainability, owned by national institutions under the leadership of the Ministry of Health and Child Care. Then there is innovation. From rolling out solar for health solutions and digital systems to constructing warehouses and laboratories, and even installing over 500 solar-powered boreholes across all provinces. We are constantly looking at new ways to make health services more accessible, reliable, and resilient. Equity is at the heart of everything. Our work deliberately prioritizes those most at risk: adolescent girls and young women, key populations, and people in rural communities. The goal is simple. No one or place should be left behind in the fight against HIV, TB, and malaria. And finally, reform. Together with the government and the Global Fund, UNDP has supported reforms in supply chain systems, financial management, and governance. These changes may not always be visible, but they are critical for transparency, accountability, and building trust in the health system.
Thank you, Dr. Ayo.
Thank you very much, Joyous.
Over the coming weeks, UNDP in Zimbabwe will be unpacking these themes further as we look at the impact of the UNDP project in support of the Government of Zimbabwe, funded by the Global Fund. This has been our Pulse Check from UNDP Zimbabwe with Dr. Ayodele Odushola.